It starts small: a scratch, a cut, a bruise. These seemingly minor injuries can quickly escalate. Within hours, your own flesh can begin to die, a process that can be both rapid and devastating. This initial stage often goes unnoticed, but the underlying damage is already beginning. This is gangrene, a severe condition where body tissue dies due to a lack of blood flow or a serious bacterial infection. In its most aggressive form, known as necrotizing fasciitis, it spreads faster than your body can fight back. Necrotizing fasciitis is often called flesh-eating disease due to its rapid destruction of soft tissues, including the fascia, which surrounds muscles, nerves, fat, and blood vessels. Gangrene occurs when oxygen can't reach tissue. This can happen from trauma, infection, or blocked blood flow, such as in conditions like diabetes or atherosclerosis. Without the vital oxygen supply, cells suffocate and die, leading to the characteristic tissue necrosis. This lack of oxygen is the fundamental cause of all types of gangrene, whether dry, wet, or gas gangrene. Necrotizing fasciitis goes deeper, as bacteria release potent toxins that destroy muscle, fat, and fascia at astonishing speed. These toxins are highly destructive, liquefying soft tissue and overwhelming the body's immune response. The infection can spread along the facial planes, causing widespread damage beneath the skin's surface. Some forms, like gas gangrene, are particularly insidious because they thrive without oxygen. This severe type is often caused by bacteria such as Clostridium perfringens, which multiply rapidly, releasing toxins and gas within the tissue. This gas literally splits tissue apart from the inside, creating a bubbly appearance and a crackling sound when touched. It's not just a simple infection, it's a complex biochemical invasion. The bacteria produce enzymes and toxins that actively break down the body's tissues, leading to rapid destruction and systemic effects. This internal destruction is what makes these conditions so dangerous and fast-acting. The first sign may be pain, a deep, disproportionate pain that seems far worse than the visible injury. This is often followed by swelling, heat, and discoloration of the affected area. These early symptoms can be subtle, but recognizing them promptly is crucial for effective treatment and better outcomes. As the tissue dies, the skin turns black, blistered, and becomes cold to the touch. A sweet, foul odor often signals gas release, a hallmark of tissue decay, particularly in wet and gas gangrene. This progression from initial discoloration to black, necrotic tissue indicates severe and spreading damage that requires immediate medical attention. Gangrene and necrotizing fasciitis are dire medical emergencies. The dead tissue must be removed immediately, sometimes through surgical debridement, where necrotic tissue is carefully excised layer by layer. In severe cases, amputation of the affected limb or body part may be necessary to prevent the infection from spreading further and to save the patient's life. Beyond surgery, high-dose antibiotics are administered intravenously to combat the bacterial infection, especially in wet gangrene and necrotizing fasciitis. Hyperbaric oxygen therapy, which involves breathing pure oxygen in a pressurized chamber, can also be used to stop the bacteria's advance by restoring oxygen levels in the affected tissues, promoting healing and inhibiting bacterial growth. Without rapid and aggressive treatment, the toxins released by the bacteria enter the bloodstream, causing sepsis, a life-threatening condition where the body's response to infection damages its own tissues and organs. This can quickly lead to septic shock and multi-organ failure. Mortality rates for these conditions rise significantly with each hour that passes without intervention, underscoring the critical need for immediate medical care. However, with early recognition and aggressive care, there is hope. Prompt diagnosis and a comprehensive treatment plan can significantly improve outcomes, saving not only the affected limb but also the patient's life. This emphasizes the importance of vigilance and quick action when these conditions are suspected. Recovery from gangrene and necrotizing fasciitis is often extensive and challenging. Wounds may require skin grafting to cover damaged areas, and in cases of amputation, prosthetics may be necessary to replace what was lost. Rehabilitation focuses on restoring strength, mobility, and preventing future infections, often involving physical therapy and ongoing medical management. Prevention begins with awareness and proactive health measures. This includes proper wound care, such as cleaning cuts and wounds thoroughly, and vigilant management of underlying conditions like diabetes, which can impair blood flow and weaken the immune system. Prompt attention to any signs of infection, such as persistent pain, redness, swelling, or a foul odor, is also crucial. The human body possesses remarkable healing capabilities, but it must never be ignored, especially when faced with severe infections or tissue damage. Maintaining good hygiene, controlling blood sugar levels for diabetics, and avoiding risky behaviors are all vital steps in preventing these devastating conditions. Every infection, no matter how minor it seems, starts small. Recognizing the early signs of gangrene or necrotizing fasciitis and seeking immediate medical attention can make all the difference. By acting quickly and decisively, you save not just tissue, but life itself, preventing irreversible damage and ensuring a chance at recovery.